Dear ladies and gentlemen, high blood fat, also known as dyslipidemia, is an increasingly common health issue in modern society. It raises significant concerns due to its potential to lead to serious cardiovascular events such as stroke and myocardial infarction. Our busy lifestyles, unbalanced diets high in saturated fats and refined sugars, combined with a lack of physical activity, have significantly contributed to the rising prevalence of this condition. However, it's important to recognize that high blood fat can be effectively managed through dietary adjustments, adopting a scientific lifestyle, and with the support of certain natural herbs. This essay will detail 4 foundational approaches to naturally, safely, and sustainably regulate blood fat, providing a useful knowledge system for individuals to proactively care for their own and their family's health. Understanding cholesterol and inflammation. First and foremost, it's crucial to properly understand the nature of cholesterol. Cholesterol is not entirely harmful. It is an essential type of fat synthesized by the body, playing a vital role in forming cell membranes and participating in the repair of damaged tissues. When the body experiences chronic inflammation, the liver responds by increasing cholesterol production to patch up the inflamed areas. The problem arises when this inflammation persists, leading to an excessive accumulation of cholesterol within the arteries, forming atherosclerotic plaques. These plaques narrow the blood vessels, impede blood flow, and significantly increase the risk of blood clot formation, leading to myocardial infarction or stroke. Therefore, the key to balancing blood fat lies not only in reducing cholesterol, but also in controlling systemic inflammation and adjusting one's lifestyle. Pharmaceutical solutions versus lifestyle changes. Currently, many people tend to seek pharmacological solutions like statin drugs to lower blood fat. It's undeniable that statins are valuable drugs, proven through numerous studies to effectively reduce the risk of myocardial infarction, stroke, and death in high-risk patients. However, like all medications, statins also carry potential side effects, including muscle pain and fatigue in some users, and particularly the ability to deplete coenzyme Q10, a crucial nutrient for cardiovascular health. Some preliminary studies also suggest a potential impact on hormones, though no clear conclusions have been drawn yet. Therefore, adhering to a doctor's prescription for statins is mandatory. However, for cases where blood fat levels are not excessively high or immediate medication is not indicated, prioritizing lifestyle changes is a reasonable and effective strategy. In fact, many individuals have successfully brought their blood lipid levels back to a safe range without long-term dependence on medication or by using lower dosages. 4 natural approaches to blood fat control. Here are 4 natural approaches that can be applied to control blood fat. Step 1. Adjusting to a scientific diet. Diet accounts for 70% to 80% of the results in blood fat control. Focus on the following food groups: green vegetables and seeds, especially dark leafy greens, chia seeds, and flax seeds, which are rich in fiber and omega-3 fatty acids, effectively reducing inflammation. Whole grains. Oats, brown rice, and quinoa provide abundant soluble fiber, helping to reduce cholesterol absorption in the intestines. Anti-inflammatory foods. Green tea, rich in EGCG, has powerful anti-inflammatory and antioxidant effects. Garlic has been shown to help reduce bad cholesterol, LDL, and increase good cholesterol, HDL. Legumes provide high-quality plant-based protein. Extra virgin olive oil and avocados offer healthy monounsaturated fats. Omega-3 sources and blood sugar stabilization. Wild-caught salmon is an excellent source of omega-3. Sweet potatoes and yams help stabilize blood sugar, limiting inflammatory reactions caused by high blood sugar. Simultaneously, it's crucial to minimize foods that cause inflammation and raise blood fat, including processed foods, sausages, canned goods, refined sugar, alcohol, hydrogenated industrial oils, soybean oil, corn oil, and conventionally raised red meats. Step 2. Increasing appropriate physical activity. Regular physical activity plays a key role in increasing HDL cholesterol, good fat, and decreasing LDL cholesterol, bad fat. Furthermore, exercise helps improve blood circulation and reduce inflammatory markers in the body. Exercise does not require excessively high intensity but needs consistent maintenance. Brisk walking for about 30 minutes daily, or applying interval training methods like alternating fast and slow cycling or brisk and slow walking, all yield significant benefits. The most important factor is consistency and daily frequency of exercise. Step 3. Utilizing natural herbs. Some common herbs can naturally support the process of lowering blood fat. Garlic, as mentioned, has scientific evidence for helping regulate LDL and HDL levels. Green tea, with its active compound EGCG, is a powerful anti-inflammatory and antioxidant. Turmeric contains curcumin, a compound renowned for its strong anti-inflammatory properties, helping to protect blood vessel walls. Incorporating garlic into meals, drinking green tea, or daily turmeric milk are simple ways to leverage these benefits. However, it's important to note that concentrated herbal essential oils should not be consumed directly without medical advice. Step 4. Considering supportive nutrient supplements. Some nutrients can be considered for supplementation to optimize blood fat control. Omega-3 from krill oil. This form of omega-3 has good absorption, has been shown to help reduce triglycerides, lower LDL, and increase HDL, while also having strong anti-inflammatory effects. Coenzyme Q10. This nutrient is particularly important for protecting the cardiovascular system, especially for those using statin drugs. An important note is not to self-administer products containing monocolin K from red yeast rice for extended periods without a doctor's guidance, as this active ingredient works similarly to statins and can harm the liver and kidneys if used incorrectly. Conclusion: controlling high blood fat is a process that requires persistence and comprehensive lifestyle changes. There is no instant solution that can yield results in just a few days. However, by consistently and correctly applying the 4 approaches mentioned, from dietary adjustments, increased physical activity, supportive herbs, to necessary nutrient supplementation, significant improvement will become evident after a few weeks to several months. For the safest and most personalized plan, consulting with doctors or healthcare professionals based on specific test results is essential, ensuring that all interventions are appropriate for each individual's health status and underlying conditions.